Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. I wish you are doing a great preparation in the next 40 days left over. And there's a lot that we can do together, studying every day. Every day morning, 10 o'clock, there is a full-scale grand test. Please take opportunity to solve it on the Score NEETPG app. And evening, we will have a discussion of the paper. Keep improving every day so that when the real D-Day comes, you are ready to fight with arms with the examiner. After all, NEETPG exam is very, very easy to crack. So let's make the great beginning, Doctor. Good to see four online classmates. Can you please punch whether the voice is loud and clear for all of you? So let's make a start. Regarding the gram-positive organism which is being shown in the figure. So what is the organism, doctor? So this is called Chinese letter pattern. Chinese letter pattern, which is caused by Corynebacterium. It is a gram-positive organism. So it can cause skin infection is the true statement. Now, here you have a liver biopsy in a patient who has got long history of alcoholism. So why there is a development of steatosis whenever the person is regularly consuming alcohol? It is because of if you look at the alcohol, what is alcohol? Alcohol is ethanol. Ethanol converts into acetaldehyde. Acetaldehyde will give rise to acetyl group. And what is triglyceride? Triglyceride is glycerol, which is 1,2,3 propane triol. Glycerol is 1,2,3 propane triol. Whenever the fatty acids combine and replace this OH group, that become triglyceride. So these fatty acids originate from acetyl-CoA. Acetyl-CoA comes by the metabolism of ethanol. So that's how ethanol metabolizes to form acetyl-CoA. Acetyl-CoA gives rise to fatty acids. Fatty acids combine with glycerol to form triglycerides, which get accumulated in the form of fatty liver, is what you need to remember. Very nice to see Shweta and many more who are all online. A 1-year-old boy has had repeated pyogenic infections with streptococci, staphylococci, and Haemophilus. But the T cell function, granulocyte function, complement activity, they are all unaffected. Serum IgG is 50. Flow cytometry shows absent expression of the heavy chain, and T lymphocytes are slightly increased with a normal CD4, CD8, and his lymph node biopsy has been shown to you. So what is a very characteristic feature that you are seeing in this? There are no germinal centers. Normally, there are germinal centers supposed to be there, which are not there. So this is a lymph node which has got germinal centers, and this is a lymph node without germinal centers, which is characteristic of hyper IgM syndrome. Once more, many times, इसके पहले बार भी बोला, अभी भी बोल रहा हूँ, doctor, that primary immunodeficiency disorders is the favorite MCQ of the examiner. अगर आप नहीं पढ़े तो you are losing. So please kindly go to Score NEETPG app. हमने इम्यूनोलॉजी बोल के डिस्कस किया इसमें जरा आप ध्यान दीजिए और सर्च में जाके आप टाइप कीजिए हाइपर आईजीएम, आपको पूरा सिंड्रोम्स के ऊपर जो भी नोट्स हैं वो सब आएगा, जो भी एमसीक्यूज है प्राइमरी इम्यूनोडेफिशिएंसी, यू विल गेट देम. Try to do a quick revision and fill the gap if you did this question wrong. So the diagnosis is X-linked agamaglobulinemia of the Bruton, where there is a failure of maturation of pre-B cells with associated absence of mature B lymphocytes and the plasma cells, and failure of the antibody synthesis is what you need to remember. Which will not lead to histopathological changes which are being shown in the liver biopsy slide, doctor. So what are you seeing in this liver biopsy slide? So fundamentally, chronic hepatitis. So cirrhosis, emphysema is alpha-1 antitrypsin. Hemochromatosis is excessive iron, and that lead to chronic liver disease, skin pigmentation, arthritis, hypogonadism, etc., etc. Similarly, hemosiderosis lead to massive iron overload and lead to the development of because of the parenteral iron overload. So there is a reason liver involvement is a feature of typically a liver involvement with cirrhosis is a feature of the hemochromatosis, cystic fibrosis, and alpha-1 antitrypsin. There's a difference between hemosiderosis and hemochromatosis. Be very sure about it. Now, 19-year-old man with sudden onset of left-sided pleuritic chest pain and dyspnea. He has no past medical history. And BP is 110/70, pulse is 95, chest X-ray is being shown to you. So what you are able to see, doctor? There is a thin border of the lung. Can you see this? Whereas here there are no bronchovascular markings in this area, right? So this is all air. So it is a pneumothorax is what you need to remember. That's the reason you need to do the aspiration of that by putting an intercostal drainage tube is considered to be the treatment of choice. Very nice to see 12 online classmates. Now, 70-year-old man presented with increasing dyspnea. He suffered MI 2 years previously. There is oxygen saturation is 85% and his chest X-ray is being shown to you. So, which drug has been prescribed most likely, right, to treat his ventricular arrhythmias, which led to the development of this condition? Amidaron. Everything about amidaron you need to know, doctor. Amidaron lead to pulmonary fibrosis. Amidaron lead to verticillate keratopathy. Amidaron lead to hypothyroidism, hyperthyroidism. Both of them are caused by amidaron. Everything, anything about amidaron, definitely एक क्वेश्चन के बिना नीट पीजी नहीं होगा amidaron के बारे में. So understand, doctor. So this is the story of amidaron. 29-year-old from Jammu is referred to respiratory clinic with increasing shortness of breath. He smokes 5 to 10 cigarettes per day and drinks 30 units of alcohol. And his BP is 132/72, pulse is 80, regular, scattered V's, coarse crackles and auscultation. Hemoglobin is 13.5. Chest X-ray is being shown. And pulmonary function testing shows obstructive defect. So what is the most appropriate treatment for this emphysematous bullous condition? So you need to give inhaled corticosteroid and long-acting LABA is what you need to give. Like salmeterol is a LABA, whereas salbutamol, terbutaline, they're all what short-acting beta-2 agonist, SABA होता है. So, predominant lower lobe emphysema. Whenever any patient who is less than 30 years presenting with lower lobe emphysema, you should think of possibility of alpha 1 antitrypsin deficiency, especially when they have raised liver function tests, is what you need to remember. Very nice to see Afro Sultana. That's good. That's good. Very good, doctor. Every day, please take test. Bring back the tiger inside you, that fighting spirit that I can win. That is the attitude you need to have when you are going to an exam like NEETPG. And let me tell you, doctor, all my effort, all my endeavor is to bring out the tiger inside you, lion inside you, where you have confidence, the grit, the challenging spirit that I can revise. And I'm so happy when I happen to see you all taking the test every day, improving one step a day every day, and then becoming confident every day. That is what we need to do to become one day topper in NEETPG. Now, 48-year-old gentleman with moderate COPD, multiple previous presentation, comes to emergency with 2-hour history of mild pleuritic chest pain. His imaging has been shown to you, right? So once more, this is showing pneumothorax. Pneumothorax, this is all air. You need to basically aspirate and admit for 24 hours observation. So there is a small apical pneumothorax because of the underlying lung disease, and this can be called as secondary pneumothorax. So according to the guidelines, if the patient is under 50, minimally breathless, if there is a rim of air is less than 2 centimeters, then initial intervention is only aspiration and observation for 24 hours is what you need to remember. 24-year-old woman presents with a rash for the past 2 weeks. She also complains of bilateral knee and ankle pains for the same duration. So what is the finding that you expect on skin biopsy? So fundamentally, it is Henoch-Conleen's purpura. Henoch-Conleen purpura, which is a palpable vasculitic purpura. Always vasculitic purpura or palpable thrombocytopenia caused purpura are all impalpable is what you need to remember. So what is the histopathology of Henoch-Conleen purpura? Typically, there is a fibrinoid necrosis. IgA, fibrin, complement C3 are the ones which are deposited. And what is that called as? Leukocytoclastic vasculitis is the name given for Henoch-Conleen's purpura. So if you have done this question wrong, doctor, remember that one minute, doctor. Now, continuing our discussion, is my voice loud and clear for all of you? Shweta, Afroz, and everybody. Can you please feedback me quickly because I'm delivering from the home. So that's the reason I'm always skeptic about the internet speed when delivering from home. Can you please punch? Without a break, are you able to get clear voice and video broadcast? Now, 23-year-old man presents with a history of chest pain. His ECG and 2D echo are shown in the figure. Systolic function appears to be normal. So which feature is a recognized risk factor of sudden cardiac death? So look at the ECG, doctor. Always when you look at ECG, what you are seeing here, there are T-wave inversions classically. And also you can see the 2D echo, the LV outflow tract, this is aorta. And this is the interventricular septum, which is swollen. And when the blood is flowing from the left ventricle into the from left atrium into left ventricle into left ventricle outflow tract into the aorta, that is the time where interventricular septum and the anterior mitral leaflet come closer to each other, and they lead to obstruction in the case of the HOCM. So the most important recognized risk factor for sudden cardiac death in this case is the presence of the mitral regurgitation is what you need to remember. So what is ECG showing? ECG is showing significant QRS complexes in the lead V6, which is suggestive of left ventricular hypertrophy. So left ventricular hypertrophy, and typically in these people, younger age diagnosis and non-sustained VT are the markers of sudden cardiac death. Then 40-year-old single man returned from Kumbh Mela with mild bloody diarrhea, lasted for 2 weeks, lost 2.5 kgs, lower abdominal cramping discomfort. And what is the most likely diagnosis, doctor? His physical features are showing presence of arthritis. So he has diarrhea, he developed arthritis. Then what is the most likely possibility? So Campylobacter infection is one of the commonest cause of inflammatory diarrhea. So diarrhea may be mild or there may be bloody. Symptoms will last a little longer. Then they develop reactive arthritis and Reiter syndrome, where he can't pee, he can't climb, he can't see. See because of uveitis, climb because of arthritis, pee because of urethritis. The combination is called as the Reiter is what you need to remember. So very nice to see 15 online classmates. Good, doctor. Please drop a line to all your friends. Every day, सुबह 10 बजे होते ही आपको स्कोर नीट पीजी ऐप में 10 बजे होते ही एक नया ग्रैंड टेस्ट पब्लिश हो जाएगा. तो उसका डिस्कशन जो होता है शाम पे होता है. आप सुबह सुबह उठ के नेक्स्ट 40 days daily NEET PG grand test, whatever be your level of preparation, do it. And evening come for discussion. I will ignite you by quickly making you to solve at least 100 questions out of this 200. Remaining, you have all explanatory answers, everything. Then you identify what are the 10 topics. 10 topics I am getting clean bold. जैसे हेनॉक्स कॉनलिन परपिरा आप रॉन्ग किया इस मॉक टेस्ट में, तो हेनॉक्स कॉनलिन परपिरा बोल के सर्च में टाइप करो वो स्कोर नीट पीजी ऐप में. Immediately all MCQs, all notes on the Henox Colin Parpina will come to you. Just quickly do the revision. That is how you need to improve day by day, day by day, day by day, so that next 40 days, even if you did not prepare till yesterday, no problem. Next 40 days is good enough for you to become the topper if you follow every day. All right, doctor? Good. Now, a 32-year-old businessman returns from a trip abroad. He presents Few days later, complaining of pain on urination. He has urethral discharge, arthralgia, ocular examination is being presented to you, right? So, what is your diagnosis, doctor? So, myocarditis, aortitis, pericarditis, they are all found to be in association with Retus. Retus is associated with HLA-B27. So, what is meant by pair? Pair. These are called seronegative spondyloarthropathies. P. Psoriasis. A. Ankylosing spondylitis. Right, doctor? Ankylosing spondylitis. One minute, doctor. Just 1 minute. So, continuing our discussion, what is pain? Pain is psoriasis, ankylosing spondylitis, I for inflammatory bowel disease, and R for Reiter. So, these are all seronegative spondyloarthropathies. Now, a 68-year-old woman with arrhythmia is being shown in the figure is admitted for cardioversion. The procedure resulted in a successful sinus rhythm. So, what is this rhythm and which drug is responsible for this rhythm is the favorite question of the examiner. So, uh, in order to restore the sinus rhythm after a DC cardioversion of atrial fibrillation, what you are able to see is the atrial fibrillation, atrial flutter, the sawtooth pattern, right? So typically, once you do the cardioversion, then emidaron is considered to be superior to maintain the sinus rhythm, is what you need to remember. That's the whole idea. Now, doctor, 56-year-old from Ajmer presents to the emergency medicine department with chest pain. His ECG is being shown to you. Now, he has a history of smoking, hypertension. He is hypotensive, bradycardic, and he is taken to catheter lab. He was stented. And few hours later, he is persistently hypotensive, poor urine output. He has elevated JVP. So, what is the next important part of the management? So, what are you seeing here? Classically, what you are seeing is ST segment elevation. Where are you seeing that lead 2, lead 3, and AVF? When you see in lead 2, lead 3, and AVF, It means inferior wall myocardial infarction. Always remember the very, very important rule, doctor. What is the important rule? Whenever inferior wall MI is there, whenever right coronary artery occlusion is there, then you need to pump a lot of fluids. When the right heart suffered myocardial infarction, you need to pump a lot of fluids, increase the preload. If you increase the preload, then the cardiac output will improve. Whereas, whereas if you find left coronary artery occlusion, whenever the left side of the myocardium got infarcted, then never give fluids. If you give fluids when left heart failed, pulmonary edema will worsen and patient will die. There you need to give diuretic like furosemide. Whereas right heart failure, you need to give fluids, dump fluids with a large bore needle. You need to run the fluids if it is a right heart failure, like in the 2-3 AV of inferior wall MI, RCA involvement, there you need to give fluids, whereas left heart involvement, you need to give diuretics is what you need to emphatically remember. 45-year-old female or male, long history of alcohol abuse, deteriorating confusion, he is drowsy and his imaging is being shown to you. So what you are seeing, ring enhancing lesion. So ring enhancing lesion always means cerebral abscess. 56-year-old with increased sweats and change in shoe size, BP is 180/94, visual field examination. Uh, Visual field examination is being done. So what is this, doctor? There is a macroglossia. Macroglossia is a case of acromegaly. Acromegaly is what you need to remember. So in him, you need to do oral glucose tolerance because growth hormone, glucagon, epinephrine, any of them, whenever they are excessive, then they lead to development of hyperglycemia and glucose intolerance is what you need to remember. 55-year-old lady came with monoclonal paraproteinemia. Her skull radiograph, what is it showing, doctor? There are lytic lesions in the skull. So it is a case of multiple myeloma. 60-year-old lady, ECG is being shown to you. ECG is being shown to you. A random blood glucose concentration is found to be 240. So what are you seeing here? You are seeing ST segment elevation. So you need to commence IV insulin. So Digami study has shown that whenever there is elevated glucose concentrations with a sliding scale insulin for 24 hours post-infarct, even if they are not diabetic. So that's what you need to do. A lot of times whenever heart attack is there, all our focus will be there on controlling the myocardial infarction. But you should also look at the sugars because stroke, heart, MI, both of them can lead to hyperglycemia. Loss of sugar control can occur. Now, 45-year-old from Bangalore, 3-month history of sweat and weight gain of 7 kgs. His sweats tend to be worse in the morning and with exercise. Her CECT abdomen is being shown to you. And what is the most likely diagnosis? Her BMI, she is having obesity also. So it is a case of insulinoma. Sorry, BMI is only 30. Okay. So insulinoma, a patient with sweats and weight gain and sweating exacerbated by exercise or fasting, along with lightheadedness, with hypoglycemic episodes, you will only think of insulinoma, and that is called Somogy phenomena. Somogy phenomena, sudden hypoglycemic attacks with symptoms of hypoglycemia, which are resolved by eating sugar, is called Somogy phenomena. In case of insulinoma, is what you need to remember. All right, doc. Now, can online students in the middle can punch? Is the voice loud and clear for all of you one more time? Because I'm presenting this at speed. And tell whether the voice is loud and clear for all of you. Now, doctor, a 43-year-old female school teacher from Mumbai complains of slowly increasing breathlessness, elevated calcium, enlarged liver and spleen. Radiograph is being shown to you. What are these called? Potato nodes, which are typical of sarcoidosis, is what you need to remember. A 54-year-old with respiratory clinic, increasing shortness of breath, taking amidaron, omeprazole, amlodipine, ramipril, atorvastatin, restrictive defect on pulmonary function test. So chest radiograph is being shown to you. So what are the most likely possibility? As we already discussed, amidaron is known to lead to development of pulmonary fibrosis, is what you need to remember. So what are all the drugs that lead to pulmonary fibrosis, doctor? The list you need to be very clear about. Thank you, Shweta and Afroz, for the feedback that the voice is clear. Good. Now, what is the most commonly recognized drug that causes pulmonary fibrosis? Amidaron, bleomycin, methotrexate, busulfan, gold, nitrofurantoin, penicillamine, any of them can lead to the development of pulmonary fibrosis. Previously, 92-year-old with history of hypertension presents to emergency, right-sided hemiplegia and dysphagia. Urgent CT is performed and it is being shown to you. You can see a huge infarct. You look at the density here and density here. And also there is a midline shift which is there. So up to how many hours you can give alteplase? So the golden period is up to 4.5 hours you can give the alteplase, is what you need to remember. 57-year-old woman with increasing shortness of breath, history of hypertension. She takes amlodipine and reflux esophagitis, Raynaud's phenomena, and the radiograph of her hand is being, actually not hand, okay, hand is being shown. So what do you see? This is not the gold ring, this is calcium that she is wearing. So this is the calcium deposition, right? So classical spotter in the tomorrow's NEETPG exam. So which autoantibodies are there? So it is a classical case of scleroderma. Scleroderma is having anti-SCL70 antibodies. So I leave the literature for you, doctors. In the Score NEETPG app, you have all these explanations. So absolutely nothing to worry. You can do the revision. Renal crisis, pulmonary disease, GIT complications, dry eyes, pulmonary fibrosis, etc., etc., etc. So anti-smooth muscle antibodies are seen with autoimmune hepatitis. Anti-SCL antibodies are encountered type of anti-nuclear antibodies. 40-year-old Raynaud's phenomena, dyspepsia, arthralgia, ESR high. ANA is positive, rheumatoid factor negative. What is the most likely complication? Once more, this is another case of systemic sclerosis. What is the main reason that systemic sclerosis patients can get affected? They have increased fibroblastic activity. There can be limited cutaneous form, diffuse cutaneous form. So they have crest. CREST means calcinosis, Raynaud's phenomena, esophageal dysmotility, sclerodactyly, telangiectasia. So they develop GIT complications, pulmonary disease, renal crisis, dry eyes and mouth, and the GIT involvement can occur from mouth to anus, and it lead to malnutrition, malabsorption. They are the things which can happen. So very good, Shweta. CREST syndrome, excellent. So keep punching you some comments that come to your mind so that learning will be very dynamic, very easy, right? 33-year-old female with the lesions which are being shown to you. So what are these, doctor? Target-shaped lesions. Target-shaped lesions, which are typically called erythema multiforme, which is caused by sulfa group of drugs like sulfasalazine, is what you need to remember. Even nevirapine among the antiretroviral, lamotrigine among the anti-epileptics, sertraline, pantoprazole, simple pan can cause, tramadol, any of them can cause Steven-Johnson syndrome, doctor, so be careful. Pan, for every pain, tramadol, but there is a risk of developing Steven-Johnson. Similarly, sulfonamides, cotrimoxazole, penicillin, cephalosporins, fluoroquinolones, vancomycin, NSAIDs like piroxicam, ibuprofen, naproxen, simple diclofenac can cause, doctor, the Steven-Johnson. Anti-TB drugs like rifampicin, ethambutol, isoniazid, pyrazinamide, anything can cause. So please do review the various drugs. Very good, Shweta. Target lesions of erythema multiforme. A 65-year-old with a history of smoking presents with a chronic cough, hemoptysis, and weight loss, and his imaging is being shown to you. Imaging is being shown to you. So what is your answer, doctor? Always squamous cell, small cell. These are the two tumors which are central. Whereas adenocarcinoma is peripheral, is what you need to remember. So the central tumors, squamous cell carcinoma has cavitating lesion also. This is the central perihilar mass lesion is what you are able to see. 42-year-old with BP 90/60. And what are you seeing here? There is a hypotension in this patient. There is fungal infection involving the nails. So, what is the possibility? 21 alpha hydroxylase is the enzyme involved in cholesterol pathway. And that lead to salt losing congenital adrenal hyperplasia. 54-year-old with polysymptomatology, examination finding is being shown to you. So what is this called as, doctor? Shawl sign, right? And so what is your, sorry, not shawl sign, weakening, I'm sorry, weakening of the muscles, atrophy of the muscles, atrophy, almost there is a hollowing of the muscles. So what is the possibility? Motor neuron disease, cervical spondylosis, and spinal muscular atrophy, anything. Not multiple sclerosis can explain this much of wasting. Simple. Now, in the small intestine of a 42-year-old with malabsorption, so what are you seeing? Villus atrophy with a lot of infiltration by the lymphocytic infiltration is what you are able to see. So you need to give tissue transglutaminase in celiac sprue. It generates the antigenic epitopes present in the alpha gliadin is what you need to remember. 81-year-old female is admitted after a seizure. She was drowsy, temperature is 37.5, BP is 192 by 108. There is aphasia, mild right hemiparesis. Imaging is being shown to you. So what do you have here, doctor? A full crescentic shaped hypodensity, which is subdural hematoma. 29-year-old woman with diarrhea, progressively worsening, multiple stool samples. Loperamide has no effect. There is a history of hyperparathyroidism. Her father had a tumor which caused hypoglycemia. CECT abdomen of this patient is being shown to you, right? So CECT abdomen of this patient is being shown to you. So what is the likely feature if you do biochemical testing? So what is this patient is having? Diarrhea, multiple stool samples are negative, loperamide has no effect, family history of hyperparathyroidism, a tumor causing hypoglycemia. So it is a multiple endocrine neoplasia. Multiple endocrine neoplasia is the underlying cause, and typically this patient will show the VIPoma, the vasoactive intestinal polypeptidoma. Typically they develop VADA, diarrhea, hypokalemia, watery diarrhea, hypokalemia, echlorohydria, right? So now doctor, 39-year-old from Noida presents with pain and tenderness. She has a flu-like symptoms. BP is 135 by 72. TSH is less than 0.05. Thyroid isotope scan is being shown to you. So what you need to remember is the thyroid isotope scan is showing decreased uptake of radioactive iodine. So today only, if you did this question wrong, doctor, is the broadcast clear for all of you? Can you please punch? The broadcast is clear for all of you? Please punch a quick feedback. So, flu-like symptoms, neck tenderness, decreased radioactive iodine scan, they all fit the diagnosis of subacute thyroiditis, doctor. Generally, whenever patient has thyrotoxicosis, how do you know thyrotoxicosis? Because TSH is less than 0.05. Whenever thyrotoxicosis is there, you expect an increased radioisotope uptake, but here there is a decreased radioisotope uptake, which is suggestive of subacute thyroiditis of D. quervain is what you need to remember. Good. Thank you, Afroz, Dalia Mondal, Shweta, and everybody. Very good. So, very nice to see Mondal from West Bengal, Kolkata. So, keep following these MCQs, clinical questions, discussions on that. It will be very, very helpful. Even if you are an undergraduate student also, these discussions, ultimately, these are the fundamentals that you need to master. Thanks for joining this session. And after this session is over, we will have an exclusive session for you, Mondal. So now, 20-year-old right-hand dominant male cricketer from Hyderabad is noted to have clutching his right shoulder, which is in very pain. He refused to let anyone move his right arm from its current position of slight abduction and external rotation. Shoulder appears full, front of the shoulder. Acromion is prominent in comparison to contralateral side. and a AP radiograph is taken. So what do you find here? You find a defect. So what is that called as, doctor? 20-year-old sustained trauma to right shoulder. Radiograph, typically there is a right glenohumeral dislocation and hill sac lesion. The defect you are seeing on the superior aspect is there, no? This defect is called hill sac lesion. When the shoulder is dislocated, the head of the humerus will be hitting the overlying acromion, and that lead to development of a small gap in the superior aspect which is called hill sac lesion. अगर इधर नीचे पार्ट में है तो डिफेक्ट इसको बोलते हैं बैंकर्ड, ऊपर वाला होता है हिल सैक, राइट डॉक्टर? So what you have seen is not bankered. What you are seeing in the radiograph is hill sac. So for the anterior dislocation of shoulder, non-operative immobilization and internal rotation is considered to be the treatment of choice. A 22-year-old medical student reveals abnormality in the differential count, and his physical examination is being shown to you. She frequently had such episodes, especially in spring, summer. Mein, there is an increased vascularity you can see. So, what is your diagnosis? So, it is fundamentally release of histamine from mast cells. So it is a type 1 hypersensitivity with hay fever. The allergic reaction which involves the conjunctiva is what you need to remember. So this is the ocular lesion. You can see here the ocular lesion. So what is this lesion and what is true about it? So fundamentally, it is a case of retinoblastoma. So this is retinoblastoma. If you do the ocular examination, no, this retina के सामने एक खड़ा हुआ है रेटिनोब्लास्टोमा, बराबर? So क्या हो जाता? White reflex will appear when you look through fundus, and what is that called? Leukocoria. Leukocoria. So this is very characteristic of retinoblastoma. So it is localized on 13q chromosome. Retinoblastoma patients also have a risk of osteogenic sarcoma and pineal tumors. It is autosomal dominant. Yellowish white pupil reflex is the presentation, sometimes is as even presenting feature. 37-year-old dyspnea, right pleuritic chest pain. And what do you see? See, doctor, this is the border of the lung. Barabar? And here there are no bronchovascular markings like this. This is normal. Here no bronchovascular marking. That means there is all air. So that is the reason this is a case of pneumothorax. So pneumothorax typically, when it is so significant and large in size, you need to do video-assisted thoracoscopic surgery. So he is an ex-smoker. So always, when do you do in a case of pneumothorax? Video-assisted thoracoscopic surgery. Whenever there is a second ipsilateral pneumothorax or bilateral spontaneous pneumothorax or a spontaneous hemothorax, or if there is any persistent air leak, similarly certain occupations like pilots or divers, then you need to do video-assisted thoracoscopic surgery. Very nice to see Rosie Kiran, Dalia Mondal, Afroz Sultana, Shweta, आप सबके फरमाइश पर हम अभी आज आपको प्रेजेंट कर रहे नीट पीजी मॉक टेस्ट डिस्कशन. 50-year-old lady from Calicut, severe rheumatoid arthritis, You have given disease modifying anti-rheumatic drugs. She is currently on methotrexate. Also, she is receiving anti-TNF alpha monoclonal antibody, that is infliximab. Her disease is dramatically improved. Now she has fever, pleuritic chest pain. Her radiograph is shown. No evidence of synovitis. What is the diagnosis? So it's a case of rheumatoid arthritis, radiograph being presented to you. So when she is being used, given so many immunosuppressant drugs like infliximab to treat her rheumatoid arthritis, she is at a great risk of developing TB. That's what exactly happened in this patient. There is a development of tuberculosis, is what you need to remember. For a 1 centimeter insulinoma in the distal part of the body of the pancreas. If it is only 1 centimeter, insulinomas can be treated with enucleation. Enucleation. 67-year-old in New Delhi presents with obstructive jaundice. Ultrasound shows gallbladder is distended, bile duct is dilated. There is a mass in the head of the pancreas indicating there is cancer. What is the most important investigation? CT scan. It will show the size of the tumor, infiltration. MRI is also good. But ERCP, MRCP can help to diagnose, but they can't let you know what is the chances of resectability. That's the reason CT is the best. Commonest type of mesenteric cyst is chylolymphatic cyst, not enterogenous. In Hirschsprung's disease, there is lack of ganglion cells on suction biopsy, which is confirmatory test for the diagnosis. 68-year-old from Visakhapatnam with aortic stenosis, with diabetes, with profuse maroon colored. Oh my God, that is the clue. Per rectum. What is the most likely cause? Vascular malformations are very common in elderly people, doctor. And angiodysplasias can cause a presentation with fresh maroon colored bleeding. In diverticular disease, it does not lead to carcinoma, but intestinal obstruction, pericholic abscess, and fistula can occur. Ulcerative colitis is affecting rectosphygmoid, sparing the descending right and transverse colon. So, if the disease is limited only to rectum, then cancer is less common. True. So, almost 25% of patients with ulcerative colitis have only proctitis, which can persist for long. Tenesmus is more, diarrhea is less, and cancer is rare. What is meant by tenesmus? Tenesmus का मतलब क्या होता है? A feeling that I want to go to the washroom, but nothing comes out. Right? So Dahlia is asking, sir, please give more information on tension pneumothorax. Very simple. Tension pneumothorax क्या होता है? So you have the lung. Around that you have the pleural cavity. So whenever there is any rupture of the lung, I mean, if there is any opening of the lung, a small bulla inside the lung is broken, then air escapes into the pleural cavity, and whenever it is escaping into pleural cavity, it created a valve-like thing, so that air goes into the pleural cavity, but it cannot come back into the underlying lung. Because of that, more and more and more air keep increasing, and then the size of the pleural cavity become increasing, and it will compress the lung. And this is called as tension pneumothorax. And when the air is increased in the pneumothorax, it will compress the lung so much that the trachea become deviated to opposite side. The entire mediastinum, heart, everything is pushed to opposite side, which is called tension pneumothorax. Did you understand, Dahlia? Now, कॉमनेस्ट साइट ऑफ ऑब्स्ट्रक्शन gallstone ileus कहाँ होता है? Distal ileal obstruction is most common for the gallstone. So typically you have the liver, under that you have the gallbladder, and you have the small intestine. So where you have duodenum, jejunum and ileum. कभी कभी क्या होता है, the gallstone in the bladder will directly make an entry through a fistula into the intestine and come and sit in the ileum, and it lead to obstruction of ileum. That is called gallstone ileus. What is the commonest variety of intussusception, doctor? Ileocolic is the most common. Cochlea, the whole apparatus responsible for us to hear, hearing apparatus, is developed by what age? By 12 weeks embryonic life. What is the length of external auditory canal, doctor? 24 millimeters. Outer 1/3 is cartilaginous, inner 2/3 is bony. Prusac space, where is it present? It is in the epitympanum. So once more, please go back to the SCORE NEETPG app. SCORE NEETPG app. So there you have ENT notes. पूरा ENT में हमने 900 पैराग्राफ्स में डिस्कस किया. आप वहां जाए तो आपको प्रोसेक्स स्पेस, ये सब चीजें हमने डिस्कस कर चुके और वो वीडियोस भी अवेलेबल हैं. सो टुडे ओनली, डॉक्टर, those who have not downloaded, please download SCORE NEETPG app. Both iOS and Android is available. Both iOS and Android. इसमें आपको क्या मिलेगा? 40,000 MCQs as subject wise tests, 70 full scale grand tests and discussions. NEETPG. You also have 1200 pages notes available as 10,000 flashcards. And you have 600 hours of video. Everything you get for a throwaway price. Today only take opportunity. Now, doctor, what are the boundaries of the Prusac space? Prusac space. Laterally pars flaccida, medially neck of malleus, superiorly lateral malleolar fold, and inferiorly lateral process of malleus. Women with postmenopausal bleeding. When do you need endometrial sampling? If the endometrium thickness is more than 5 mm. Large amount of alkaline phosphatase is demonstrated in endometrium in which phase? Proliferative phase. But levonorgestrel releasing IUD, there's an increased incidence of menorrhagia. What is menorrhagia? Increased bleeding is called menorrhagia. What is dysmenorrhea? Pain during menses is called dysmenorrhea. Dysmenorrhea. Right, doc? Now, myxoma peritoneae may occur because of mucinous cystadenoma whenever it ruptures. In adenomyosis, there can be menorrhagia is the most common symptom. Subnuclear vacuoles in endometrial mucosa. Where do you see? Whenever progesterone is released. So typically the menses cycle is, you have the ovulation. After ovulation, you call secretory phase. Before that, you have proliferative phase. Proliferative में estrogen ज़्यादा काम करता, and estrogen increases the size of follicle until follicle ruptures and releases the ovum. And that is done under the influence of luteinizing hormone, which surges 48 hours before ovulation. And after that, corpus luteum is that ovum which released the, after the release of the ovum, it is called corpus luteum. Graphian follicle is called corpus luteum. And this really produces progesterone. Progesterone comes and makes the proliferated, typically proliferation of the endometrium occur during pre-ovulatory proliferative phase. After that, it will create secretory changes and make it ready for implantation of fertilized ovum. If the pregnancy did not happen, by 28th day, corpus luteum stop working, stop producing progesterone, and there is a progesterone levels fall suddenly, and that causes the development of menses, is what you need to remember. So, everything you need to be very sure, doctor. Uh, In the early secretory phase, under the effect of progesterone, vacuoles containing subnuclear intracytoplasmic granule appear in these glandular cells. That is what you need to remember, Shweta. So, commonest cause of the death in cancer cervix. So, whenever cancer is involving there's the uterus, cancer, I mean cervix and vagina. So, whenever it is involving the cervix, it goes and invades the ureter surrounding it, and that lead to obstructive uropathy. Obstructive uropathy. That lead to development of uremia. Ultimately, cervical cancer patients die in the hands of nephrologist, is what you need to remember. Primary drainage of the lower vagina, it goes to superficial inguinal nodes. So remember, upper one third follows lymphatic drainage of cervix. That is vagina's upper one third. Lower one third drains into inguinal lymph node. Middle one third both into the upper and lower directions. Most common cause for acute peritonitis is gonococcus. In the CAN, carcinoma in situ, lower socioeconomic status, multiple sexual partners, onset of the coitus at early age, they're all considered to be the risk factors. Now, doctor, which cells produce surfactant? Clara cells. That is in the conducting part of the lungs. Clara cells in the epithelium of the respiratory bronchioles, you're able to see. So, club cells, also known as bronchiolar exocrine cells, originally called Clara cells, सब कुछ एक ही है. They are dome shaped with short microvilli found in the small airways. Club cells are found in ciliated simple epithelium, and they secrete glycosaminoglycans to protect the bronchiolar lining, is what you need to remember. Bursa communicates with the knee joint suprapatellar bursa. So, you have the patella. There is a suprapatellar bursa, which typically suprapatellar bursa communicates with the knee joint. Which muscle causes abduction of vocal cords? Posterior cricoarytenoid. Typically, posterior cricoarytenoid will cause the abduction, is what you need to remember. So you can remember Titanic. Where is the hero standing behind Kate? He's standing behind. Whatever. So he is posterior cricoarytenoid like guy. So what is he doing? He is extending her limbs. So abduction is caused by posterior cricoarytenoid, is what you can remember. So now, doctor, which tract carries thermal sensation? Lateral spinothalamic tract. Subarachnoid space continues until S2 vertebra, second sacral vertebra. Heart rate accelerates during inspiration and decelerates during expiration. इसको क्या बोलते हैं डॉक्टर? Sinus arrhythmia. Sinus arrhythmia. So whenever you're taking breath, normally only heart rate increases, decreases, which is called sinus arrhythmia. Heparin prevents coagulation by making antithrombin 3 become very strong. Bone absorption is inhibited by resorption, is estrogen. That's the reason postmenopausally women are vulnerable to develop osteoporosis, is what you need to remember. Thirst is stimulated by increase in plasma osmolality and decrease in plasma volume whenever you are having hypovolemia whenever you are dehydrated is what you need to remember. GFR to renal plasma flow is called filtration fraction. GFR is decided by what, doctor? Inulin clearance. Renal plasma flow is determined by PAH clearance, is what you need to remember. One minute, doctor. Now, electron transport chain and inhibitors of electron transport chain is a favorite question of the examiner, doctor. So, cyanide fundamentally inhibits complex 4. Complex 3 is by antimycin A, is what you should remember. So, मैं आप सबसे ये निवेदन कर रहा हूं कि 70 full scale grant test, doctor, full scale grant test of NEETPG pattern. Already we finished the 30 grant tests and all those discussions, grant tests, PowerPoints, everything are there. 40 more we will be delivering before March 5th. Please take every chance to attend them. And 17 to 200 ये 14,000 में से ही आपको पूरा 200 आउट ऑफ 200 आएगा कल के नीट पीजी में, और कुछ भी पढ़ने की जरूरत नहीं है, खाली इसको सॉल्व किया आपने एंड improve 5 to 10 topics every day by going back to the Score NEETPG app. More than enough for you to crack the NEETPG exam. Now, which amino acid does not allow formation of alpha helix? Proline. So, जहां भी proline रहता है, bend लेता है. Right? Whenever proline is there, the protein chain will take a bend. One more proline here, it will take a bend. One more proline here, it will take a bend. So that is the purpose of proline. Because proline में क्या होता है ना, एक रिंग वाला स्ट्रक्चर रहता, वो सीधा रहने वाले प्रोटीन चेन में जमता नहीं, तो इसलिए एक टर्न ले लेता है जहां भी प्रोलीन हो. So correct 3 ends of the histone mRNA, right? For production of them, what is required? snRNA. It is a highly repeated MCQ with high probability in PG medical entrance. So, small nuclear ribonucleic acid snRNA is also called uRNA. They are found within the splicing speckles and cagal bodies in the cell nucleus. The length of an average snRNA is about 150 nucleotides. That transcribed by RNA polymerase 2 or 3. Right? And their main function क्या होता है? Processing of the pre-messenger RNA in the nucleus. HNRNA को processing करने के लिए आपको snRNA का जरूरत पड़ता है. They will also help to aid the regulation of transcription factors or RNA polymerase 2 and maintain the telomeres is what you need to remember. So there are various syndromes that are known to occur because of the problem in these small nuclear ribonucleoproteins like spinal muscular atrophy, dyskeratosis congenita, Prader-Willi syndrome, where there's a deletion of the paternal chromosome 15 that is not expressed on the maternal chromosome. That's what you need to remember. A small interfering RNA क्या होता है? That the short interfering RNA, otherwise called silencing RNA. The main function is mRNA need to be broken down after transcription, resulting in no further translation. That is the purpose of siRNA. So I leave the literature for you, doctor. What is microRNA, everything. This session is too short for taking this in a greater description, right? So good to see Deepthi, Dole, Afroz, Sultana, Shweta, Dalia, Mondal, Rosie, and many more who are all online. रोज मिलेंगे रोज पढ़ेंगे एक दिन कामयाब होके दिखाएंगे दुनिया को हम नीट पीजी का टॉपर बन गया. Now, doctor, so those who are new to this today's program, if you are attending first time, please WhatsApp 9000868356. लिख लीजिए नंबर. Subscribe to 70 full scale NEETPG grant tests on Score NEETPG app today by calling 9000868356. We love to see you becoming NEETPG toppers. Today only WhatsApp 9000868356, our helpline number, doctor. We'll be more than happy to help you guys. Now, xeroderma pigmentosum, the cells fail to repair because of the nucleotide excision repair. So, हमारे बॉडी में क्या होता है? Damaged base जब भी हो तो glycolase will typically create a purine AP site. AP endonuclease will break it, and in turn there is an excision repair done. This is defective in xeroderma pigmentosum. Allopurinol is a xanthine oxidase inhibitor, all of you know. Swimming pool granuloma is Mycobacterium marinum. So tomorrow NEETPG, this can come like an image-based question. You need to be 100% sure about it, doctor. Immunoglobulin has a special role against helminthic infections, IgE. Now, would streptococci cause neonatal meningitis? Streptococcus agalactiae lead to neonatal meningitis. And what is the test, doctor? Christy Atkins Munch Peterson. और एक बार बोलो मेरे साथ. Christy Atkins Munch Peterson CAMP test is an important test to identify group B streptococci is what you need to remember. I leave the literature for you. Please do revise. बहुत बार इसके बारे में हमने हमारे नीट पीजी ग्रैंड टेस्ट में डिस्कशन कर चुके हैं और ये सब जरूर आने वाला क्वेश्चंस है. Simple, doctor. 200 questions come from 400 high yield topics. ये 400 टॉपिक्स क्या है और इसके ऊपर 10 पॉइंट्स आपके मुट्ठी में रहे तो 4000 पॉइंट्स के ऊपर आपको काबू आ गए तो नीट पीजी खत्म, खेल खत्म, दुकान बंद. अगर आप मैं ये कोचिंग को जाना, वो कोचिंग को जाना, क्योंकि वो 1 लाख रुपए दे रहे हैं और वीकेंड में सुबह से शाम तक मुझे दिमाग के ऊपर पेंटिंग कर रहे हैं, मैं जाके वो दिल्ली से आ रहे, इधर से आ रहे, नो नो, दैट्स ऑल वेस्ट ऑफ टाइम. Similarly, there are so many apps today available, but the problem is every app guy want to show his power. देखो, medicine means I will give you 3000 pages notes. Bullshit. Who want 3000 pages notes for medicine, man? Nobody can do the revision. So let me tell you, doctor, there are 1200 pages notes which is already there in the Score NEETPG app. I'll also courier you the printout. Each subject is finished in 30 pages to 40 pages. Simple revision. ये सबका वीडियो डिस्कशन अवेलेबल है. आप खाली इसको मास्टर करना. अभी तो नेक्स्ट 30-40 डेज में मेन थिंग फॉर यू टू गेट सीट, यू नीड टू टेक एज मेनी मॉक टेस्ट, everyday mock test, and attend a live discussion and identify 10-15 topics and then go back to Score NEETPG. There is no other way. All right. Now, what is the special strain used to Corynebacterium, diphtheria, and throat swab, Dr. Albert Stein? Albert Stein. The test done to check whether pasteurization is completed properly is phosphatase test. Second generation antihistaminics. They have less sedation, more antipruritic action, less psychomotor problems, is what you need to remember. They do not cross the blood-brain barrier. That's the reason you don't have CNS effect. So what are all the antihistamines which are topical? Ezelastine, olopatadine, levocabastin. Then you have terfenadine, bipos. Terfenadine is that famous Allegra we use, no? Yeah, that is the one. So astamizole, cetirizine, loratadine, misolastin, ebastin, all these systemic. Now, doctor, which anti-malarial drug is used in combination with artemether in a fixed combination? We use lumefantrine. Once more, let me tell you, anti-malarial, anti-tuberculous, antiretroviral, anti-leprosy, anti-helminthics, and antifungals. Compulsory 5 MCQs sure shot आएगा out of 200. मैं बोल रहा हूँ ना, 200 क्वेश्चंस आने वाला 400 टॉपिक से बस, एंड ओनली 4000 पॉइंट्स, 10 पॉइंट्स पर टॉपिक आपके मुट्ठी में रहना. 4000 पॉइंट्स अगर आपके हाथ में रहे तो खत्म, आप टॉपर बन जाओगे. सो वी यूज अ लॉट ऑफ आर्टिफिशियल इंटेलिजेंस एल्गोरिदम्स. No other NEETPG coaching provider does that. हमने सेंटिमेंट एनालिसिस बोल के एक एल्गोरिदम बनाया. सेंटिमेंट एनालिसिस. इफ यू लुक एट द डोनाल्ड ट्रंप इलेक्शन और मोदी जी का इलेक्शन, so the same technology and algorithm is used to know what is the sentiment of people so that you can create a manifesto, election manifesto. उतना सोफिस्टिकेटेड AI इंजन को हम यूज करके नीट पीजी एग्जामिनर, INI-CET एग्जामिनर एंड UPSC जिपमर, इसके पहला जिपमर था, PGI एम्स, ये पूरा क्वेश्चन बैंक्स में सेंटिमेंट एनालिसिस क्या है, what examiner want to test, what you need to prepare करके हमने रिकॉग्नाइज किया 400 sure short topics. Every time examiner keep asking more or less the same things. Every paper में cervical cancer रहता, every paper में OCPs रहता, every paper में waste disposal और उसका color of the bag रहता, every paper में vitamin के ऊपर एक क्वेश्चन रहता. Like that you can easily predict what examiner want. खाली वो अच्छा प्रिपेयर हो रहा, ऑटोमेटिकली सीट आएगा. नाउ डॉक्टर, adrenergic neuron blocking drug is guanethidine. So guanethidine is transported across the sympathetic nerve membrane, similar to the way norepinephrine is being uptaken. Once it entered, it concentrates in the transmitter vesicle and it replaces the norepinephrine. So that is how typically the guanethidine acts like a blocker. तो ये जाके विसाइकल के अंदर बैठ के नॉरेपिनेफ्रिन को रिलीज करेगा. नॉरेपिनेफ्रिन जाके क्या करेगा? It will go and bind with the presynaptic receptor alpha 2, and that decreases the sympathetic outflow. That's the mechanism. Erythromycin is beneficial for gastroparesis because it acts on motilin receptors. So you have the motilin receptors. In H. pylori, what is the triple therapy that you use, doctor? Omeprazole, metronidazole, and amoxicillin is what you need to remember. Bismuth subsalicylate, metronidazole, and tetracycline BMT for 14 days. Omeprazole, amoxicillin, clarithromycin, OAC for 10 days. And lansoprazole, amoxicillin, clarithromycin is also approved. Now, antiplatelet agents, aspirin, ticlopidin, and clopidogrel. Remember, doctor, thrombolytics, antithrombotics, antiplatelets, one MCQ, and anticoagulants like warfarin. इनके बारे में जरूर एक क्वेश्चन आएगा हर एक नीट पीजी में. Very, very high yield, hottest stuff. 40-year-old male presented with pallor splenomegaly for 4 months. Few basophils shifted to left. What is your diagnosis, doctor? Chronic myeloid leukemia. So, shifted to left का मतलब क्या होता? Immature myelocytes, when they all increase in the blood, you call it as shifted to left. So this is the bone marrow where, what is this, doctor? These are called OR rods. इसको क्या बोलते? OR rods बोलते. ठीक है? In AML. Langerhans cell histiocytosis, CD1A, all the CD markers is a big boring job. Beer-Beck granule, CD1A positivity is the Langerhans cell histiocytosis. Similarly, S100 protein also. Peanut agglutinin is expressed. MHC class 2 is expressed. CD1A is called Langerin. CD207 is called Langerin. Is also found, is what you need to remember. Now, what do you see whenever Langerhans histiocytosis is there? Typically, there will be calvarial defects. Calvarial defective lesions will be found. So this is a Hand-Schuller. One of the spectrum of the Langerhans histiocytosis is Hand-Schuller Christian disease, where you find calvarial defects. BRCA1 and CA2 inactivation lead to breast carcinoma. A person with head injury become unconscious for 3 days. completely cured after 10 days, he was discharged. What is this called? Grievous injury, emasculation, etc. Take 007 dishum will be there in exam, doctor. Stellate wound, star shaped wound. Where do you get it? Contact shot. Incised wounds with hesitation cut means there is a suicidal tendency. तो सुसाइड करने के पहले वो सोचता है मरना या नहीं मरना, मरना या नहीं मरना, मरना या नहीं मरना, इसलिए हेजिटेशन कट्स होता है. Very nice to see 22 online students, doctor. Very good, very good. So, हर एक दिन पढ़ना है. Next 40 days, you need to do the best usage. Don't let any negative thoughts. Postpone होगा, maybe. Sorry, I did not read all these days. How will I make it? वो सब सेल्फ डाउट छोड़ देना डॉक्टर. आपके साथ मुरली भरद्वाज है. रोज मिलेंगे, रोज पढ़ेंगे. एक दिन कामयाब होके दिखाएंगे दुनिया को. हम नीट पीजी का टॉपर बन गए बोल के. I promise you to be with you, to hold your hand and take you forward. So today only subscribe to the Score NEETPG app, doctor. Score NEETPG app. Both iOS Android available हैं. आपको सस्ते में मिल जाएगा. And the best material, best content, best quality teacher is what you have in a very comprehensive. We are not very extensive. There are many apps which are very extensive, but we are not like that. Now, what is wrong about dying deposition recorded in the presence of magistrate? Cross-examination can be done. Right? So, dying declaration versus deposition. Declaration में आप oath is not required. Deposition में oath is required. Okay? Now, if in dead body mature maggots are found in how many hours? 24 to 48 hours. Throughout the country, every year malaria कब होता है doctor? Malaria month June. What is this? This is pellagra niacin deficiency. 4 to 8% qualified to talk about the topic, sit before and discuss. What is that called? Panel discussion. This is called panel discussion. So what is an example of a primary prevention? Measles immunization. Cervical cytology screening is early diagnosis treatment. So secondary prevention. Smoking cessation after heart attack is पूरा जलने के बाद, घर जलने के बाद पानी डाले तो उसको क्या बोलते हैं? Tertiary prevention. Self-examination of breast for lumps even before lump developed is primordial prevention. Before emergence of risk factors. So what is the minimum residual chlorine? 0.5 milligram per liter. Maternal death is defined as when mother dies during pregnancy within 6 weeks. Framingham study is an example of a cohort study. Integrated disease surveillance project. What type of diagnosis done by PSU medical officer? Presumptive diagnosis. P is probable, confirmed means L. Right? Then average number of girls that we born to a woman, if she has the same current fertility pattern with no mortality, what do you call it as? Gross reproduction rate, GRR. So what is total fertility rate? NRR, GFR, TFR, everything I leave the literature for you, doctor. A sub very closely related terms are frequently asked in the exam. For prevention of human rabies, immediate flushing and washing of the wound in animal bite. Plenty of soap and water. Water under running tap. For how much time? 15 minutes. 15 minute धोना rabies को avoid करने के लिए. So waste collected in yellow bag typically is incinerated. What is an indicator of magnitude of the completed family size? Total fertility rate is a very, very important indicator. नेहरू जी, उनका बेटी इंदिरा गांधी, उनका बेटी उनका बेटा राजीव गांधी का बेटा राहुल गांधी जी, ये पूरा क्या है? कंप्लीटेड फैमिली साइज होता है. So that is all the story, doctor. So I leave all the remaining questions for you to discuss, review in the Score NEETPG app. And thanks for joining. Tomorrow, Garma Garam question paper. Once more at morning 10 o'clock. Every day, one daily NEETPG question paper. And afternoon, we will have the discussion. Thank you all for joining this wonderful evening with Dr. Murli Bhardwaj.